have to make sure that your working hand, okay, if it is your righty, make sure it is righty, only heel of your working hand at the center of the chest. I'm just putting the mannequin on this side. So normally we call it as a septum level, okay, or the nipple line, whereas flat bone is there. If you can just notice right now on yourself, it is a flat bone. If you just go below that, you will find a junction point, okay, where the soft bone and hard bone is junctioning onto the midpoint. Please do not perform CPR onto that point. Just go below, just go above 3 fingers. That will give you a flat bone, a heel of your working hand, okay. The other hand has to be interlocked with each other like this, okay, so that will give you grip, okay. Your heel, your elbows and shoulder has to be the same line. So that means if you are comfortably sitting and performing a CPR, that will be not effective one, okay. Whole body weight should act as a CPR, and then you have to compress the chest. The technically speaking, it is 1/3 of a body size specifically, but you have to go deeper, at least 5 centimeters deep, okay. Ultimately, you will not able to measure that whether you are reaching that 5 centimeters or not. So specifically, you have to do it as hard as possible, okay. So it goes like this. Straight, okay, straight, and then compress. So
flexible.
Absolutely.
So that, provided you understand.
Right.
Where to put your palm of the hand, the ball?
This
Where to put?
at the center of the chest, okay, the nipple line, the center of the chest, okay. Now we have to continue this at least 30 bits. Then you can do 2 mouth-to-mouth resuscitation. So for that matter, make sure that we are doing that head chin lift, so that the airway passage will get open, okay, and then pinch the victim's nose and breathe out forcefully until unless you are able to see the chest rise. Now the only point is, if the patient is oozing out, the blood is oozing out, the saliva meds are present, the patient has already vomited. Now if you don't have any barrier method to use that, make sure that you just clean all the stuff which is in the mouth. The head chin lift is mandatory, okay, and then perform hands only CPR. So in that case, no mouth-to-mouth resuscitation is needed if you are doing hands-only CPR. But for that matter, you have to perform in a minute 100 to 120 compressions. So that will gives you in a second twice. So that's how the flow will go until the time. Yeah, until the time specifically the machine is reaching onto the particular spot. Okay, we are done with the CPR, that is cardiopulmonary resuscitation. You have to put heel of your working hand at the center of the chest. Your heel, elbow and shoulder has to be in the same line. So just for the demonstration, I am showing it on a table, okay? You have to, whenever you are performing, touch wood, it should not be the case. But if in case you might wanted to perform that in the life, the patient has to be settled onto the floor. You have to kneel down beside the patient and then perform the CPR. It should be never on the mattress, sofa, backseat of your car, because that will lead to compress a cushion, not the thoracic cavity. Okay, so please make sure that if that victim is healthy, you are alone, you will not able to lift that victim and get it to the floor. Make sure that something hard surface kept inside, kept just below that. Like if you are at the place, like use a chalkboard board, the writing pad, something firm surface that will give you strength for performing CPR. Okay, now till the time we have the machine at the spot. Okay, I am from the company Philips itself. So this is known as AED. So it is automated external defibrillator. So if in case of cardiac arrest, normally heart goes into a vibrations. Okay, that we call it as fibrillations. So that fibrillations heart, if you want to stop the fibrillation and then revive the heart again. So we need to induce a shock, a joules intensity.
That will be life-saving.
Absolutely right. Okay, that can save someone's life. Now the only point is, this is completely automated.